Hello, my name is Babydavidsingharvinmalvino. Today I am going to examine your eye. Is that okay?
Okay.
Okay. Firstly, I am going to perform the visual acuity test. For this, I am going to use a Snell's chart. I've asked the patient to sit 20 feet away from a Snell's chart. Can you close your left eye with the left hand and read the smallest line possible?
D E F P O T E C.
Can you close the right eye with the right hand and read the smallest line possible?
D E F P O T E C.
Okay, the patient's visual acuity is 20 by 20. If the patient is not able to read from a distance of 20 feet, you'll have to ask the patient to sit nearby and read the smallest line possible. If still the patient is not able to read it, there are some other visual acuity tests like counting fingers test and hand movement test and light perception test. Now I am going to examine the external eye. Look straight. The eye seems to be symmetrical. The alignment is normal. The eyelids, there is no masses, swellings, or there is no abnormalities. The sclera seems to be normal. There is no discharges. There is no redness, and there is no coagulation of congestion of blood vessels.
Okay.
I am going to examine the pupillary. For this, the room must be dim. Using the pen light, I am going to shine a bright light on the left eye and see the pupillary construction on the right eye. Look straight, and I am going to do the same examination on the other eye as well. The patient has intact, direct and consensual light reflex. Nextly, I am going to perform the swinging light test. For this, the room must be dim. I have asked the patient to look straight. Now I am going to shine a bright light and move alternately from one eye to the other eye. Okay. The patient's pupil responded equally, and there was no delay. If there is positive RAPD, then it is optical nerve disorder or retinal disorder. Now I am going to examine the integrity of extraocular muscle. Look at my fingernails. Follow the movement. The patient extraocular muscle movement was normal. There was no lag or nystagmus. Now I am going to perform digital tonometry. For this, I am going to palpate the patient's eyeballs using my finger pads. Close your eyes. I am going to look for the soft consistency, just like the lips. The patient's eyeball seems to be soft. Now I am going to perform fundoscopy examination. For this, the room must be dim. I am going to use an ophthalmoscope. I am going to turn on the ophthalmoscope and set it on the correct diaphragm. I am going to stand, look straight. I am going to stand 15 to 20 degree angle from the patient, and I am going to use my right hand to examine the right eye. I am able to see the red light reflex. I am going closer. I was able to see the inferior temporal, superior temporal, inferior nasal and superior nasal. I am going to perform the same examination on the other eye as well. I am going to use my left hand for this to examine the left eye. Fundoscopy examination findings. Fundoscopy examination finding was normal. I was not able to see any exudate, or there was no exudate of hemorrhages. The patient's optic disc was yellowish orange and creamy pink in color, and I was able to see the physiologic cup. I was able to see the retinal artery and retinal vein. Retinal artery was light and shorter, and retinal vein was dark red and longer. I was able to see the fovea and the surrounding macula. Now I am going to perform the confrontation test for visual field. For this, I am going to ask the patient to close the right eye with the right hand, and I am going to close my left eye with the left hand, and look at my nose and follow the numbers what I am telling. Okay, and what I am showing.
3, 2, 3, 2.
Switch to the other eye.
3, 2, 3, 2.
Okay, the patient's peripheral vision seems to be normal. This was a very successful eye examination. Thank you.